Hello, my name is Bassett and I'm a clinical marketing specialist with Elekta. Today I'm going to talk to you about critical structure avoidance. This video focuses on the treatment workflow. Please refer to our other video to see guidance on how to set up the limits. Elekta's XVI software provides the clinical user with the ability to define multiple regions of interest to complete image registration. The options include a clip box, so a rectangular region of interest, a shaped region of interest or mask, which can be defined as a structure or contour from the treatment planning system, or manually drawn. Or we can use dual registration, which is a combination of these areas designed to compare each outcome for critical structure avoidance. This functionality has been designed to help manage daily anatomical changes or baseline shifts. These can potentially alter dose distributions, decreasing the target dose or increasing the dose received by surrounding critical structures. For example, image registration focused on the bony anatomy within a clip box may not detect changes in the soft tissue, which could result in an underdose to the target. A registration focused solely on a soft tissue tumour may result in the high dose region moving closer to critical structures, therefore increasing the dose of these structures. Using a single registration method in such situations, it can be difficult to ascertain quickly if the relationship between the tumour and critical structure has changed. CSA helps automate this analysis and alerts the user if the anatomical relationship has changed, which could result in the high dose region moving closer to the critical structure. Limits, which have been predefined by the clinical team, can help the user choose an optimal position in these cases. This helps maintain the initial clinical intent and plan objectives. Let's take a look. In lung tumours, baseline shifts can result in a shift of the tumour relative to the bony anatomy. For example, when a tumour detaches from the chest wall during the treatment course. Monaco provides a highly conformal plan with Monte Carlo, providing the most accurate dose calculations for areas with changing tissue densities. The physician has approved this plan and the associated dose volume histogram. How can accuracy be maintained for this plan during subsequent treatment delivery? How can you determine whether the relationship between the tumour and the critical structure has altered? Is the high dose prescription still being delivered to the tumour? And is the critical structure still within tolerance? The clip box and shaped region of interest have been defined. The limits have been input by the clinical team for both the target and the critical structure. If these limits are exceeded, the software will notify the user. First, the clip box is registered, which produces a set of correction vectors. If we were only performing bony matching, these would be sent to the couch to move the patient. However, we want to match using soft tissue, so next we register the shaped region of interest or mask. Once this registration is complete, we get a new set of correction vectors relative to the soft tissue. You can see from the appearance of this table that predefined limits for the clip box have been exceeded. Let me describe this table. Firstly, the slider bar shows if we are optimizing to the mask or the clip box. If the slider is fully to the right, we have a perfect mask or soft tissue match, demonstrated by the 0 values. However, note that this means the bony anatomy has moved closer to the high dose region and exceeded one of the predefined limits, shown here in red. If the slider bar is fully to the left, we have a perfect clip box or bony match, again demonstrated by the 0 values. However, note that this means the soft tissue anatomy has moved from the optimal position and exceeded one of the predefined limits, again shown here in red. The user can try to find a compromise between the clip box and mask using this slider bar. If you have any questions regarding Elekta's CSA solution, please contact your local Elekta sales representative. Thank you for watching.